Hey everyone, and welcome back to the DisInformation Chronicle. I'm here today with Dr. Adam Urato, who I wrote about just recently. He was the target of a story by the Associated Press, which it was kind of a very weird story. I saw it, it floated past me on X, and the title of the article caught my attention because what it said was that this top FDA official is trying to hire a friend who's seeking a bold new warning on antidepressants. And I thought, well, that's a weird way to write an article that this woman, Tracy Beth Hoeg, who's, very controversial because industry doesn't like her. When industry doesn't like you, for some reason now, the media basically reflects industry talking points. So that caught my attention. And so I popped up in the article. I was doing something and I went back later and I read the article. And this is what really caught my attention. It's this brief paragraph within the article. And it said, within the agency, Hoeg's close relationship with Urato, this is Adam Urato, is viewed as a clear conflict of interest that under normal FDA standards would result in her recusing herself from any work on the petition. But Hoeg is actively working to speed up the agency's review of her friend's proposal, right? So it's friends twice, according to people familiar with the situation. Well, so here's something that's really funny about it. I kind of know a little something about conflicts of interest because I wrote a law on it, and I spent 3.5 years dealing with this issue while in the United States Senate, trying to clear up the problems with conflicts of interest in medicine. And the reason why is because we were dealing with corruption in pharmaceuticals, and what we kept finding is every time we found that there was corrupt action in the pharmaceutical industry, the companies can only do this because they have corrupt physicians helping them to do this, right? So the physicians are the ones, they write the scripts. The physicians are the ones who deal with the clinical trials. The physicians are the ones who go and give the talks. The physicians are the ones who sit on the panels to approve the products, right? So what we did was to try and fix all this. We can't deal with the fact that, companies want to make money. That's their job. They have fiduciary responsibility to investors to make money. That's the reason why we founded corporations hundreds of years ago in the first place. But we do have within the medical community, within medicine, is the idea that the doctors are there for their patients, not to make money. Now, we all know that that's not necessarily how the system works, but there is that idea within medicine that doctors are there for patients first, to put patients first. And some physicians actually do that, believe it or not. My wife will tell you that's what she does. So, I look at this stuff and I knew that this made no sense, that there was this idea that a friend is a clear conflict of interest because I've written laws on this. I've given talks at multiple universities. I've read the academic literature. I'm actually an expert on conflicts of interest, right? I'm contacted to talk about these issues. I have never seen the term friend ever used anywhere in a discussion about conflicts of interest because it's a made up term that is just made up because you don't like what someone's doing. So you're like, how can I denigrate their expertise? Well, I'll just call them a friend. And so what I did was I actually contacted HHS just to make sure. The other thing you should know too is I wrote as part of a series that I wrote, which won an award in England on problems during COVID. I wrote one of my stories was on the conflicts of interest for the people who approved the COVID vaccines. So I had to go through the FDA conflict of interest forms for every one of the people who was on the physicians who were on the FDA panels to approve the COVID vaccines. And the term friend is not in there. They don't ask you who your friends are. They don't ask you to disclose your friends. This is just a made up piece of nonsense, a made up scandal. So I called HHS anyway, just to make sure. They told me friend is not defined. You don't have to disclose who your friends are. This is just made up. This woman, Tracy Beth Hoeg, is doing a good job. And then the other thing that caught my attention was there was a claim in the article that what Urato was doing is he's making these claims about unproven pregnancy risks of antidepressants. Well, I just Googled. It's amazing what you can do with a little bit of Google. And one of the things that popped up was a study in a very well-renowned journal, Nature Medicine, that pointed out that there are problems with pregnant women who are on antidepressants. It can lead to, and they're pregnant, it can lead to later problems that can be actually found in the kids while they're in their teens. And there's just other studies too, all showing this stuff. So this whole article just really fell apart. And, to me, it was very disappointing. I actually know the reporter at AP, Matt Perroni, and I was just shocked to see this stuff. But we're seeing more and more of this in recent years where we're seeing reporting that just is basically reflecting back, industry talking points. And this isn't how it used to be. Maybe, Adam, I'm going to pull you in. You tell me the media profession is full of shit. I'm wrong, Paul. You've always been terrible. You come on in and tell me, how do you think I've done on my profession?
I appreciate you having me on and giving me the opportunity to talk about this. The article really is an abomination. I mean, it's an outrage. And what's really unfortunate is that they're misinforming the public with this article. There are so many things wrong with this article. I mean, I think my last count was like 8 or 9 different things wrong with the article. My petition and my focus on this is, pretty straightforward, and people can understand. These medications, the SSRI antidepressants, are commonly used by women of childbearing age, but they're synthetic chemical compounds, and they affect the serotonin system. Serotonin plays a crucial role in fetal development and pregnancy. These drugs affect the serotonin system, so we would expect them to have an impact on pregnancy and on fetal development, particularly fetal brain development. And that's what we see. The problem is that the label doesn't currently warn about these risks that are being shown in the scientific literature. So I've submitted a petition to the FDA, a citizen petition, along with my co-author, and we've asked them to put a boxed warning highlighting that these drugs, the SSRI antidepressants, are associated with increased pregnancy risks and impact or alteration of fetal brain development. Very straightforward. The AP took that and then essentially created a work of fiction. I mean, this article is false in so many ways. I don't have a close relationship with Dr. Hoeg. That's how it was described. I've met Dr. Hoeg once, and it was at the FDA at the time that I testified at an FDA panel. I've talked to her on the phone a few times about these pregnancy-related issues, but to describe this as a close relationship, also the way that they're spinning the science on this, that these are unproven claims. As you pointed out, Paul, there's numerous studies, just common sense. These are drugs that alter the serotonin system, so they're probably going to have an effect on the pregnancy and developing fetus, the developing brain, and that's what the studies show. And the idea that they spun this as being this guy with unproven claim who has a close relationship was almost something like to sound salacious or secretive. He's got these unproven claims and this close relationship with her, and now they're violating FDA standards. The article was basically like a piece of fiction. It misinforms the public, which is the real shame of it here.
I mean, it's really interesting because when I just saw it, the first thing I figured is, so when I worked on the Hill, one of the groups that I looked at a lot was psychiatrists. And so, but one of the people I exposed at the time when I worked on the Hill was a physician at Emory, Zachary Stowe, who I think had published studies about the potential problems with these antidepressants. And I caught him actually not disclosing money that he had been taking. And I'd forgotten about this, but I just knew immediately that there had been this long-running controversy and pharma was funding people to basically hide the health effects of these drugs. So I knew that this has been going on for a long time. I think it's important to you that you point out, you tell people what exactly you do, what your job is as a physician.
Yeah, I'm a full-time physician. I take care of patients. I actually work in the community where I was born and raised. I work in my local community, and I take care of high-risk pregnant women. Most of the time, I do ultrasound and consultations regarding their pregnancy. I also deliver babies. I'm very active as a clinician, but I've also, throughout my career, been involved in a number of issues where I've felt like pregnant women and the public were being misled, typically by the pharmaceutical industry, on various issues. And a couple of the more notable ones, or one of the more notable ones, was this issue about McKenna. McKenna is a drug, or was a drug that was used to prevent preterm birth. We used it in obstetrics for years, about 20 years, to prevent preterm birth. But I was one of the leading voices arguing for about 20 years that I didn't think that drug worked. I didn't think it was effective. I didn't think we should be injecting pregnant women with that synthetic hormone. So I actually petitioned the FDA about this along with Public Citizen in 2019. And I was one of the few people who was arguing this. It was generally accepted. It was considered conventional wisdom in our field that McKenna worked and we should be giving it to pregnant women. The American College of OBGYN said that. The Society of Maternal Fetal Medicine said that. Most leading experts were saying that. So I was kind of the voice saying, no, this is not, we're getting ahead of ourselves. We have to be careful here. And it turned out that as further study was done, the drug was shown to not be effective. And the FDA actually pulled that drug off the market in 2023. And so that was one of my disappointments with this article, is that the author, Matthew Peroni, he didn't introduce me to the public as someone who was a dissenting voice on this major issue about McKenna and turned out to be right here. He presented me as someone using unfounded claims, really, which was a huge disappointment.
Well, what's so funny is that when the FDA actually responded to the petition that you did and essentially affirmed the claims that you had made, the person who wrote about that was Matthew Peroni at the AP. So I mean, it's just like, I'm like, wait, how crazy does this story go? Like, I mean, this is like a South Florida crime fiction novel here. I mean, what is going on? What the next turn of the wheel is here? But then, so I wrote this initial article about you, and I thought it was just, very interesting, how the way this article was just so weird, because it's not my expectations of what I'm expecting to get out of the Associated Press, not out of Matthew Peroni, who's a very veteran reporter on covering these issues. And then it turns out that despite these errors, despite the fact that, there's no conflict of interest and you're not a friend, and even if you are, it's not a conflict of interest. It doesn't define any standards. There are proven risks of these drugs. I think you sent me, actually, it goes all the way back to 2004 with the National Toxicology Program came out with a report that said there may be problems with, this particular antidepressants with fetal development. And then in your petition, you have, I read it, it's like 20 pages of peer-reviewed studies. Now, you don't necessarily need to conclude that this means that, this is a proven risk, but it's something that certainly FDA should be considering, because this is a potential problem. I mean, women would want to know about this. I mean, any pregnant woman will want to know this. So why is AP trying to shut this down? It honestly makes no sense. And then I come to find out that the AP gave Matthew Peroni an award for this terrible article. And this to me was just so, what is the next step? And so I just want to read what they did. And what they did in the award announcements, this is an award from internally done within AP. So I looked it up. It's done by AP editors where they're self-judging their own work, right? But the way it talks about the award is honorable mention. It says, after a year of cultivating confidential sources, Peroni established that a senior FDA official, Dr. Tracy Beth Hoeg, was overseeing the review of a citizen petition calling for expanded pregnancy warnings on SSRIs, while simultaneously attempting to hire the petition's author, a professional ally. So they've removed you now from being a friend, right, to now they've softened the language because they realize how stupid they sound, right, that you're not just friend thing, it's just a made-up controversy. So they now turn it to a professional ally. But that this raises the next question: would she work with someone who was a professional enemy? I mean, what is being proven here? I mean, it just makes no sense. And then the story goes on to say, so in the past, here's how the article read in the past. The article read, viewed as a clear conflict of interest that under normal FDA standards would result in her recusing herself from any work on the petition. Well, they softened that to say, the story also highlighted how the process appeared to depart from long-standing agency norms. So they can't say that it violates conflict of interest because it doesn't. But they don't correct the article. They just soften the language in the award. And then here's the final thing that I thought was just so funny, because, again, the article was just so weird at the time. I was just trying to wrap my head around how nutty it was. But then this final little sentence in the award announcement really caught my attention. It says, by detailing who was driving the effort and how the review was unfolding, Peroni brought transparency to a high-stakes regulatory process. So I see this, and I went back and I read the article again. And this jumped out at me. This was actually just stunning. So in the article, high up, the person they called to basically say, Adam Urato's an idiot. He doesn't really know what's going on. These SSRIs are safe. It's a paragraph they use, and they quote a woman named Jennifer Payne, right? And it says, black box warning is a big red flag with practitioners and patients. That's true. That's why you're trying to get this in there so that, it'll be a warning to patients, said Jennifer Payne, a University of Virginia reproductive psychiatrist. And then she says, what's missing in this petition is an understanding of the risk of maternal mental illness during pregnancy, not just to the woman, but to the pregnancy and ultimately the infant, right? So she creates this distracting sentence, right? Because I mean, it's like saying that you shouldn't have a warning attached to oncology drugs because the side effects of these drugs, which we know, you don't even need to be treated as a cancer patient to know that they're terrible. Your hair falls out. Every random person knows this, right? That if we give them oncology drugs, they're going to have these bad side effects because the opposite thing is not getting, who's going to say, I don't want my hair to fall out, so I'm not going to take cancer drugs. It's just a nutty standard they're using. So when I see this person coming in, I got suspicious, right? And I looked her up. Do you know how I'm able to look her up? Because I spent 3.5 years working on conflict of interest issues to pass a law called the Physician Payment Sunshine Act, so I can look up physicians like her to see if she's taking money from doctors. This is what I spent my time doing, and people like Matthew Perrone and other reporters at the AP use it. And guess what I found out? Surprise, she's taking money. In 2024, Sage Therapeutics, they gave her $3,700. And I kind of know what this database says. What it says is it's compensation for services other than consulting, including serving as a faculty or speaker at a venue other than a continuing education program. When it's not CME, right, which is education for doctors, what that tells you is it's a marketing talk. They've thrown money at her. She's taken money to give a marketing talk on behalf of Sage Therapeutics. I looked up what they did is they've got this postpartum depression drug. So she's bought into these drugs being given to women.
Yeah.
And this is not disclosed in the AP story, which was plotted for bringing transparency to. I mean, how much? I mean, I'm afraid to read this article again because I don't know where we go next. So what do you think?
Got an award for this. No, there are so many things that are inaccurate about the article. I mean, it really is it's a work of fiction, this article. They describe me as having a close relationship with Dr. Hoeg. I don't have a close relationship with Dr. Hoeg. They said that she was trying to bring me on as a full-time employee, which is incorrect. The discussion was about an advisor position that would have to be very limited because I'm a full-time clinician. They said that there was a clear conflict of interest under normal FDA standards, which, as you've touched on, isn't correct. They said that there were unproven pregnancy risks. That also is not correct. And then what really bothers me, Paul, is the way that Matthew Perrone tried to spin the petition with some of the quotes. So the last quote of the article was a woman saying something to the effect of, women shouldn't be asked to white knuckle their way through depression. But that's not the purpose of the petition. So the focus of the petition is that these SSRI antidepressants have pregnancy risks and they alter fetal brain development, and that pregnant women in the public should be warned about this. That's all that is. Then pregnant women need to weigh these risks along with their personal benefits, their own assessment of mental health, and make the decision that's best for them, and then should be supported in that decision. And I've said this a million times on a million different podcasts, including in the petition itself. We make it clear that this isn't about pill shaming pregnant women. It's not about giving them a guilt trip. It's not about telling them, what to do. It's not about pulling the drugs off the market. It's very clear what the goal is. It's just getting pregnant women the right information. I always say pregnant women need compassionate care, and a big part of compassionate care is giving them accurate information. But he spun the article in all these varied ways to make it sound like a salacious relationship, conflict of interest, with this petition that's trying to either get rid of the drugs or tell women what to do, none of which is true. Then, when I reached out to them through my own emails and asked them to correct it, they gave a very limited correction on this. And then when they give themselves this Best of AP award, as you pointed out, they give themselves the Best of AP award for this article, but they're actually making a correction there. No longer they're saying I have a close relationship. No longer they're saying it represents a conflict of interest. I mean, it really is an absurdity. This article that Matthew Perrone wrote, is an absurdity. It's an abomination. It really is. And what they need to do at this point, they need to fully correct it and actually investigate it and then explain to the public, here's what went wrong with this article, why we're misinforming you, and why we've put out this horrible piece of journalism.
So who did you contact for a correction? Who did you send your correction to, your request for a correction?
I sent it into Matthew, Matthew Perrone, the lead author, as well as I believe his name is Jonathan Fahey, I think the editor on the piece, and then two of the other like the ombudsman people are the people you send to at the Associated Press that you send complaints into. I reached out to them.
I mean, I know this from journalism. You can't just lay this at the feet of Matthew Perrone, right? He's the name that's out in front, but he has an editor who agreed to this stuff. Then there are people with an AP who also agreed to not make the correction. So this is not a Matthew Perrone thing. I know this as a journalist. Sometimes you're assigned issues and you know what your editors want. This is really a problem within the Associated Press. Let's be honest now. This goes beyond just one reporter with his name on the article. It involves the entire organization. I just want to read to you, like, this was me just Googling because I actually sent questions to AP asking them, what are you guys doing? This doesn't make any sense. And one of the things that I sent them to is, you said there's unproven claims, and I sent them a link to this Nature Communications, article. And I just want to read what the title is. The title says perinatal SSRI exposure. Perinatal means to the fetus, right?
That's right. Yeah.
Okay. Exposure impacts innate fear circuit activation and behavior in mice and humans. And so when it's saying the fear circuit activation, this is a part of the brain involved in learning. I don't want to get into the complexities of that, but you're talking about the way the brain is later operating. And here's the conclusions of this article. I just want to read this to you, what the authors found. This was an article that came out in May of 2025. It says, these findings have potential implications for the clinical use of antidepressants during human pregnancy and for designing interventions that protect fetal brain development. So they affirmed this. So I asked them, I was like, has this article been, retracted? Is there something else? There was just no response to this at all. And I asked them specifically, I went to HHS. This doesn't exist. This idea of a friend being a conflict of interest. The term is not even defined inside HHS. They don't even have a legal definition for this. It's not on any of the forms. I have never seen a conflict of interest form in my life, and I've read tons of them. I've read tons of academic literature on it. There's an entire academic literature on this issue. I've never seen anyone discuss the conflict of interest of friends because people don't talk about that as a conflict of interest. It's just a weird way to discuss things. What does it mean? This was the funny thing. So we were talking. As I interviewed you for this, I'd forgotten that I'd spoken to you years ago when I worked in the Senate. And because this issue of conflict of interest, academics hate it. Physicians hate it. The pharmaceutical industry hates it because they know that the way that they get what they want in the media, right? And in the government is by basically these, hidden ties, and this is what I actually have worked on. I've worked on how this process actually works. And while I was in the Senate, I was supposed to give a talk at Tufts University, and once Tufts officials found out it was me coming to give the keynote address at the time, they're like, no, this guy is done. And it kind of it was a mini scandal at the time. It ended up in the Boston Globe. The conference organizer, he's now dead. It was Sheldon Krimsky, that guy was a god. I learned so much from Krimsky he changed my thinking about how to look at these issues, about corporate influence on not just on medicine, but on science and the way science is constructed, going all the way back to tobacco. Sheldon Krimsky was critical to a lot of journalists, a lot of thinkers in this area. And, Krimsky called me up and said, yeah, they're just inviting me. But he was upset at the time. And then about a week later, I get this phone call from this guy, this irate physician, and I'm going to be giving the talk in your place. And, what are you going to say? And I was just laughing at the time, and I remember sitting at my desk in the Senate. Okay, well, I think I'm going to say this. Hold on a second. Let me pull down my slides because I'd had a slide deck ready to go. And I'm telling this physician, here's what I'm going to say. Here are the points I think are really critical to make about this stuff, why we need to reform this problem in medicine and in academic research. And I hung up the phone just laughing at the idea that, these people who didn't want to hear what I was going to have to say, they're going to hear it anyway, but they're going to hear it from a physician who they felt was a more acceptable voice. And then you told me on the phone that physician was you. I forgot about it. And I'm wondering, is AP going to say now that we're friends because we spoke back in 2009? I don't know. Maybe we're friends now.
So that's going way back. No, but it shows how long this has been a problem for. I agree with you, Paul. I wanted to just say, though, that, and I don't mean to sound uncharitable to Matthew. I don't know Matthew Perrone, but I think that my frustration, which is coming through here, is just that this article is so far off. And you're right. It goes beyond him. And it's also the folks at the Associated Press. And a big frustration of mine is also what you touched on with the evidence that's there, like the paper that you mentioned. Part of the criticism for dissenting voices is what they're trying to say is that we're not being scientific. We're providing misinformation, things like that. But if you notice, if you listen, I'm happy to debate anybody on the science on this. And they never mention these scientific papers like the one you mentioned, or the fact that there are 12 MRI studies. So there's now been 12 studies that have been done using MRIs. These are human studies looking at the brains after exposure in utero. They look in the neonatal period, but they also look during childhood and even up to, I believe one of the studies went to age 15. And we're still seeing brain changes there from the impact these drugs are having in utero exposure. And there's no mention of that. If you read Matthew's article, if you read this AP article, there's only one risk that he actually touches on, which is the increased risk of postpartum hemorrhage. And so he mentions one risk out of the many risks and doesn't touch on the brain development issue. But if you notice, if you read these articles, a lot of them are like that. When you try to go back to them and say, what risk did they really identify? They're not identifying the risks, and they're not talking about the scientific papers on this. And then, as you rightfully touched on, the whole field is just clouded with this corruption of pharmaceutical industry money. Over the years, over many years, you mentioned Dr. Stowe, but there were groups of them over the years that have been promoting the safety of these drugs in pregnancy, the sort of SSRI proponents, and being paid by the pharmaceutical industry. And so it's created this incorrect information for pregnant women and the public about these drugs. The drugs have been basically oversold to pregnant women as not affecting the baby. I have a lot of women that come into my office and they say, I was told just that they don't affect the baby and they're safe in pregnancy. And also the second sort of lie that people are being told is that the women on these drugs, by treating their depression, are having better pregnancy outcomes. Like you treat the depression during pregnancy and you have a better pregnancy outcome, less preterm birth, less low birth weight. Science, Paul, doesn't show that. There's numerous what we call continuer, discontinuer studies where we look at the women. About half of women come off these when they become pregnant. If you look at the studies in the women who stay on their SSRIs versus the women who come off, you see higher rates of preterm birth and higher rates of low birth weight in the women who stay on the medications. The discontinuers generally do better. I tweeted about this a few weeks ago. I put up the slide. If you ask AI this, in the SSRI studies in pregnancy, the discontinuers or continuers, which group has higher rates of preterm birth and low birth weight? It's the continuers. It looks more like that continuer group is being exposed to something which is causing pregnancy risks like preterm birth, like low birth weight, which is the medication. But you're not hearing about any of these studies, and certainly not from the people that are being paid by the pharmaceutical industry.
Right. Yeah, I know. This whole thing has been, to me, just, honestly, I didn't even step back to even think about this from a broader public health perspective. I was literally just, this article is so weird. As soon as I saw this friend thing, I was just kind of like, this makes no sense to me. What is happening? Am I missing something? This is so crazy.
So I'm glad you're bringing this to the public's attention, Paul, because nobody else has really here pointing this out and really pointing out the absurdity of the article. I mean, I'm frustrated. So as I said, I apologize to Matthew, but I think, I mean, I can't imagine this article being written any worse. I mean, really, abomination is the word that springs to mind on this.
I mean, they could have tried to tie you to something else. I don't know, some wellness industry or some kind of nuttiness. I have no clue. So what the petition is, so this is the weird thing, right? I mean, I read your petition. You've got 20 pages of references showing possible health effects to the fetus. These are just references, right? So it's not even of the written part. Just here's all the references that show potential health risks to fetuses from these SSRIs. So, but what the issue now for FDA is to decide, does this information, which, I mean, I don't see how you dispute this stuff. It's published studies. How do you say this doesn't exist? It's just the weirdest. I don't even know how to wrap my